Hi, everyone, and welcome back to the Dear Asian Community podcast. Today, I'm here with Dr. Chuong. Could you go ahead and give a introduction of yourself? Thank you so much for being here with us.
Yeah, thanks for having me. I am honored to speak here. My name is Christopher Chong. I went to Pitt for my Bachelor of Science in Chemistry. I have an MBA also at John Carroll University, and I received my Doctor of Dental Medicine degree at Case Western Reserve University. I am practicing as a general dentist in Philadelphia.
Cool. So, could you just give us a brief discussion about your career journey? Like, I saw that you got an MBA and then now you also have a dental degree. So, could you talk a little bit about that?
Yeah, absolutely. So, when I was at Pitt, I did the whole pre-med thing. I think 90% of people are pre-med, and I still wasn't really sure what I wanted to do. I actually transferred to engineering school at Pitt, and then I transferred back into
Mm,
chemistry, and I was
mhm,
all over. And even, after I graduated, I wasn't sure what I wanted to do. So I pursued healthcare administration, so just an administrative role in telehealth in a home care company, and then actually thought I wanted to be a pastor as well. So I
mm,
actually did campus ministry with a group called InterVarsity for about 2 years. And then I still wasn't sure what I wanted to do. And I'm, mid 20s at this point, and
mhm,
um, delved into in a role in insurance, and then
mhm,
went to get my MBA to further career advancement. But I still wasn't sure what I wanted to do. And I found myself not as interested in the business side, and I really wanted to be
mhm,
with people and
mhm,
patients specifically. And I was volunteering at a federally qualified health center, which is a community-based program that kind of helps impoverished communities.
mhm,
And I was specifically shadowing the dental department, and I was just so inspired by how much I could impact a patient like very quickly. Like if they came with a toothache, they could leave without a toothache, and then
mhm,
the source of their pain or infection is just gone. So
mhm.
that's kind of where it led me to dentistry, but I kind of didn't know for many, many
Yeah.
years. Like I went to dental school when I was 27,
Uh-huh. Wow.
and I know we're doing this podcast here to help um, people who are, searching for a career and
Hmm.
kind of figuring out what they want to do. And, it's okay if you don't know right away. And that's kind of what I'm trying to share with my story, is that you can find that journey, and find so many things about yourself along the way. And
Hmm.
now I'm a happy practicing dentist, and I love what I do.
Yeah, wow, that sounds great. And wow, there's so many different things that you were discovering, when you were in college. So let's focus on maybe the dental school part. So did you have any obstacles or things that motivated you while you were in dental school?
Yeah, absolutely. I'll talk about the motivating aspect first, and then I'd like
Hmm.
to touch on the obstacle portion. The motivation part, I'm an Asian American, and being in this kind of role is amazing and inspiring. So I'm not sure about you, but my high school, I think maybe like there's like 3 to 5% Asian Americans.
Hmm.
And, when I went to college, it was like a whole different, um, it was a huge change where there's a ton of different demographics that I never really encountered with it from my upbringing.
Hmm.
And then I found role models who were in these positions, and it was just really cool to see how down to earth they were, but for how they have achieved so much
Hmm.
that inspired me to continue to do the same. And then another, probably biggest motivating factor is my parents. So my parents,
Hmm.
they're in Pittsburgh, and they do dry cleaning. They own a dry cleaners, and they're the epitome of hard work.
Hmm.
I think just watching them work so hard and care for their family just motivated me so much to go forth with, how much debt dental school will be, and how much time and energy I have to spend to work
Hmm.
and to achieve something great where I can maybe inspire the future generations to do something similar.
That's great that you have so many motivators. I think definitely if you have, role models that you can look up to or some guidance, it makes the journey a lot easier.
Absolutely. So, as many of the viewers may know, getting into professional school is like a very challenging journey. It's filled with high competition, a lot of hours and time and extracurriculars, I'm sure you know, as you're applying to college.
Mhm.
And because of this competitiveness, there's a temptation to maybe sacrifice your health, right? Sleepless nights,
Yeah.
that kind of stuff. Then there's also a temptation for, drug enhancement, taking
Mm,
non-prescripted drugs to help you focus, or cheating in other aspects like using phones during exams or using past exams that give you an edge over other students. Now, this is a pretty difficult topic to address. A lot of people, maybe you and your colleagues, experience some of this stuff, being COVID. I'm sure a lot of stuff was online, or
mhm,
maybe people were doing stuff together online. And then when you get to college, you'll start to see a lot of this. I want to share about this topic because I don't think it's talked about as much, but I want to
mhm,
share with like a lot of grace and humility. So, because of my values, I tried to complete my education without doing those things because I believe I'm a Christian. I want to do what I think is honoring to God. And then I also want to do what's honoring to my family and my values. And then also honoring the profession and my future patients. So getting even into college, you got to have a high GPA and do all these extracurriculars, right? So that
yeah.
doesn't stop. When you get into college, now
Mhm,
you're doing college, trying to get into professional school, I
mhm,
think that temptation gets even harder. You want
mm,
to get into medical or dental school, you got to be pretty much top of the class with hundreds of shadowing hours, all these kind of things.
yeah.
You got to look very good on your resume, and you got to be able to speak and talk the talk. Now, what's even challenging, what I faced in dental school, as well as my wife, who's also a dentist, we actually met in dental school and got married, which is amazing. We strive to do what we thought was right and try to do it again with all those things in mind for our values, our family, and honoring the profession and our future patients. A lot of students do it because they're fighting the system, the university, and the system's against us. We got to fight together. And if you want to get into oral surgery or orthodontics, dental specific, then you got to be like top of the class.
Mhm,
So people were striving to do all these things. And
yeah.
so I think that was the biggest obstacle that we face, is how do we stay true to ourselves, and how do we encourage our colleagues with our, just ability to stand firm in our faith and beliefs, and try to model it to other people. Like, hey, you can be successful and not
Mhm,
do those things. You can work
yeah.
hard and not sacrifice your health
Yeah.
and still do these things.
Mhm. Yeah, for sure. I can totally relate to the cheating aspect as I was in high school during like the COVID time. As you mentioned, a lot of things were online and, it was just very easy and sort of accessible for people to just not do the work and just have other people kind of do the work for them. And in a way, it kind of benefited them and didn't benefit the people who were actually trying to work, I felt
Mm.
like. And I feel like we really should focus, like you said, on, the people who are, and then also about, not going to sleep. I'm guilty of that. Sometimes when it's exam season, I pull some, not all-nighters, but I still go to sleep pretty late. And I think, it's not really that beneficial in the long run. Maybe it'll help me like remember one more thing for the test, but I definitely need to learn fix that aspect. And I think it's encouraging to hear that from somebody who's already has, a career that they like, and it's not just me, I guess. So yeah,
Oh
thank
yeah.
you so much for sharing that. I also just wanted to ask you, so now that you found a career that you like to pursue, could you just share a little bit maybe about what a day in the life of a dentist looks like, or, how do you interact with patients? Is it ever difficult?
That's a great question, and I'm really happy to hear about your commentary, and I'm sure
Hmm.
this will lead to future discussions with yourself and maybe other people. Um,
Yeah.
I'll first make a comment about being a dentist.
Yeah.
I think anybody can do the dentistry. Like, anybody can go ahead and learn how to do stuff with their hands, and you can learn and memorize as much. So a day in a life is about that aspect of being compassionate. So, I do a bunch of exams with patients. So usually a patient comes in for their cleaning. This is what's the hygienist, and then I have my own separate column
Hmm.
with patients too. But then I'll do an exam,
Hmm.
I'll look in the mouth, head and neck cancer screening, and then we'll talk about their care. If they have any treatment or questions about anything, about brushing, about their oral health. And then on my own column of patients is when I do treatment. So that's the fillings, the crowns, extractions, could be root canals, could be a lot of different things. So
Mm-hmm.
It's kind of like I'd be bouncing back and forth to lots of different rooms. So each
Mm-hmm.
hygienist has their own room and list of patients, and then again I have my own list of patients. So typically I'll see about maybe 20 to 25 patients per day,
Mm-hmm.
and again, just being efficient, but also making sure I spend adequate time of being that compassionate individual that they need, and then doing the dentistry. I think the most memorable experience I had is I had a patient come in,
Mm-hmm.
an older woman who hadn't been to the dentist in like 10 years because she's so scared. You know, so
Mm-hmm.
much anxiety about getting teeth pulled and hurting, teeth hurting and things like
Mm-hmm.
that. And she came in. We spent most of the time just like kind of chatting, just talking and showing examples of literally what exactly each step along her process would be, and what treatment plan we would have. So not just that day, but what would it look like, months or months down the road, and how do we help her? And then eventually she did need a couple of teeth extracted,
Mm-hmm.
and giving the injection, she used to be very scared, but she wasn't. She was very calm, and she said it didn't really hurt. And then we took out the teeth, which can be pretty scary and traumatic. I'm sure you can understand.
Yeah.
Um, but she was actually really grateful and said all of her pain had gone. The pain that she'd been having for maybe years was gone after, the 2 weeks of healing or
Mm-hmm.
whatnot. So I think that really taught me how much I could do as a dentist for somebody, help her overcome years of mental and emotional stress. It's
Mm-hmm.
like so fulfilling to see.
Yeah. Yeah, wow. That must be very rewarding. And
Yeah.
wow, I'm so glad for that patience. Um, so yeah, actually over the summer I went to like shadow a local dentist. It's actually my dentist. So I went to kind of go to the clinic and just see what he does. And I actually was able to like look at like a teeth extraction. So that was
Ooh.
yeah, it was wild. I've never seen that before.
Yeah.
Yeah, it was
Wow.
very cool. Yeah, just to see what you guys can do and how you guys can help other patients. I also got to just see some of like the technology that they use maybe to get scans of teeth. Just
Yeah.
like things that you wouldn't see just being like the patient. So yeah, that definitely helped to kind of increase my both my respect and interest in dentistry. So going along with that, like what is your advice for seeing different careers or, finding the career that's right for you?
Yeah, absolutely. I was thinking about what would I say to my younger self and to
Uh-huh.
the audience here. I have four things. Chris, it's four goals or advice to help younger generations find a career.
Hmm.
Let's talk about each one. So, explore different careers. You should shadow, just like you were talking about. You shadowed a dentist. You saw a wild procedure, right? It's like, man, that's crazy. Scanners and teeth pulling and all this cool stuff. A lot of different careers can offer something really fun too. You maybe want to be an engineer, or you really like looking at numbers. You want to be a financial analyst. Like, there's so many different options. Call people up, email, and I just ask, hey, can I just spend the day with you to see what this is like? Because you're really only going to know once you immerse yourself in it. And
Hmm.
you may even want to spend a long period of time. So when I shadowed at that federally qualified health center, I was there for 7 months.
Hmm.
I was in my MBA and I was volunteering and shadowing for 7 months. And I was like, man, I love this,
Hmm.
right? I wasn't always sure, right? I was 27. That's when I went to dental school. So you got to explore and ask a lot of questions and meet with a lot of people. The second one, stay true to yourself, your goals, your beliefs, and your values. I was talking about health and talking about your ethics. You want to stay true to who you are and who you want to become. The person that you spend the time becoming, like in college or high school, even in college, professional school, and after, that's kind of the person that you're going to be. The things that you would say and do, and the way you think, the way you immerse yourself in those settings of academia is kind of the clinician or practitioner or analyst or whatever career it is, that's the kind of person you'll become. So to be able to find out what your identity and what values that you have is like of the utmost importance, because
Hmm.
that will lead to everything else. Like, I believe I am a good clinician because I have empathy and compassion and a desire to put patients first. Like they're number one. They're the most important person in that room. And
Mhm.
then the dentistry is easy. Like doing the actual procedure is easy.
Mhm.
Number three, be open to change. So many times I have been challenged with my own, thinking like, oh, I think this is the right way to do it, or I think I can do it this way. And I realized someone else's opinion really mattered. I'll be open to listening to so many other people's opinions and then do research on them. Like in science, there's so many different things. In healthcare, there's many different ways to do a procedure right. And that really perplexed me a lot.
Mhm.
But being adaptable, I think, is one of the most important characteristics that will make you successful in your future endeavors. The
Mhm.
last thing is, yeah, do not be afraid to ask for help. We don't know a lot of stuff. I still don't know a lot of stuff.
Mhm.
I was able to, achieve great success in my dental school curriculum, finishing, top of my class for clinical procedures. But I still need help. I still don't know how to do a lot of surgical stuff. And, you shouldn't be afraid, even in high school, to ask your colleagues, hey, I don't know how to do this,
Mhm.
calculus problem. Can you help me? Or your teachers. And in college, you'll see, like, I don't understand microbiome. you know, and don't be afraid to see what other people like the way that they think and
Mhm.
understand how they can explain it to you. Then it might just change your perspective on something and
Mhm.
then make you a better person and a better practitioner of whatever you do.
Mhm. Yeah. Yeah, for sure. Wow, that was very thorough advice. Thank you so much. I think it's very important to just, be open to asking questions or maybe when people challenge you, like just being open to discovering new things, like you said. So yeah, thank you so much for all this insight and great advice. Unfortunately, that is all the time that we have today. But I'm so glad that you could join us today.
Yeah, I'm so happy to again have the opportunity to speak. Thanks so much for doing this. This is wonderful. I think it's so helpful to everybody who's watching. And I just extend the invitation. And should anybody have questions they want to personally contact me, I'll leave my email for you guys. And you guys, I'm in the Philly area. If you want to come shadow, I would be honored to show you what a formal day in the life is like.
For sure. Thank you.
All right, thank you.